Hello, good evening, everyone. All right, as I informed you all that my next revision lecture on for MRCS part A will be about the joints of the elbow. So let's talk about the joints which strengthen the elbow joint. Continuing again from the Netter's anatomy flashcard, I want you to look at these following these following markings of the structures or the ligaments around the elbow joint. I want you to identify and tell me, this is you're looking at the humerus bone in 90-degree flexion. This is the lateral view and this is the medial view. I want you to look at this structure. Number one, it's evident, visibly evident here. And number two, this is radius bone, so this is lateral. This is medial bone, so it's medial. Have a look in the lateral view. And now on the medial view, in the 90-degree flexion, you're again looking at structure 5, 6, 7, and 8. And I want you to find out and tell me or identify these ligaments which strengthen the elbow joint. If we move down and look at the structures in the lower or the anterior view, so this is number 3 and this is number 4. This is again humerus, this is radius, lateral side, ulna, medial side. This is open joint. You can see joint has been opened to reveal these structures, and this is like really evident even on the posterior view. And this is radius, medial side, ulna, medial side, and radius, lateral side. And this is humerus. And again, the same structure 3 is visible here. So these are the structures which form the elbow joint. And then you have to identify and you have to figure out these ligaments which strengthen the elbow joint. What are these? What type of joint is elbow joint? What are the structures which strengthen the elbow joint? And in what position elbow joint is weakened, especially in children? So these are all the questions that I want you to answer me or have an answer for that. If you'll revise and you'll know the answer, or you can pause and you can find out the answer. Otherwise, I'll be discussing it now. Have a look. In number 1, in this image, I want you to focus on the fact that this is pointed out here on the humerus, and this is the joint capsule of the elbow joint. This is the joint capsule of the elbow joint. Number 2 is the radial. See, I told you, this is radius, this is ulna. So it's coming from there. So it's radial collateral ligament. Number 2 is radial collateral ligament. Again, joint capsule of the elbow joint, radial collateral ligament. These are the ligaments which strengthen the elbow joint. Now moving to number 5. I'll tell you, this is the tendon of biceps brachii. Biceps brachii tendon. This is radius, this is ulna. And you know, in the flexion of the medial view, 90% flexion of the elbow joint. In the medial view, this is number 5 is biceps brachii tendon. Number 6, have a look on the radial side. You can see it's the annular ligament of the radius. It's annular because it forms a circle, right? And it uncovers the head of the radius. So it's the annular ligament of the radius, number 6. Number 7, have a look. This is ulna, and this is the joint, and this is the ligament on the joint. This is called ulnar collateral ligament. This is ulnar collateral ligament. And number 8 is triceps brachii tendon. It inserts here. This is olecranon process of the ulna. So triceps brachii tendon. So if I tell you again, number 1 is the capsule of the elbow joint. Number 2 is the radial collateral ligament, starting from radius, attaching here. Number 5 is the biceps brachii tendon. Number 6 is the annular ligament of the radius. 7 is the ulnar collateral ligament. 8 is the triceps brachii tendon. Moving below, two things you have to identify here, 3 and 4. So have a look, this glistening this glistening marked area is the synovial, it's the synovial membrane, because elbow joint is a type of hinge type of synovial joint. So if it's hinge type of synovial joint, only 2 types of movement, flexion, extension, are allowed at this joint. And number 3 is the synovial membrane. Number 4 is the articular cartilage. See, it's white. So this is the articular cartilage, and this is also the articular cartilage. And same articular cartilage you can see over here on the, this is the capitulum of the humerus, and capitulum of the humerus and the head of the radius. See, this is radius, head of the radius, right? And the, you know, it's in the olecranon process of the trochlear notch of the ulna, between the trochlea of the humerus and the trochlear notch of the ulna. So these are the ones. And if I tell you, this joint articulates in the proximal radio-ulnar joint. See here, you can see here is the proximal articulation of the radius and ulnar, radio-ulnar joint. And it's also synovial joint. It's a type of synovial joint. And its main function is it participates in supination and pronation. So that rotation of supination and pronation takes place at radio-ulnar joint. Okay. Apart from that, I've already told you at the elbow joint, it's only the flexion and extension, 2 movements that take place at elbow joint. Whereas at radio-ulnar joint, which is the proximal articulation of the radio-ulnar joint, only pronation and supination takes place. And I've already told you from all the structures which strengthen, coming back again, strengthen the elbow joint. These are all the structures which strengthen the elbow joint, and the annular ligament also. This annular ligament, it holds the head of the radius in its place. Blood supply, if I tell you of the elbow joint, so it is supplied by the brachial artery, branches of the brachial artery, recurrent collateral branches of the radial and ulnar arteries. This is the blood supply of the elbow joint. Now, one more important or the significant clinical feature or clinical significance of the elbow joint is that when we pull children from the arm, and if we pull it really forcefully or with the direct violence or direct force, then it can damage this annular ligament and causes the dislocation of the proximal radio-ulnar joint in children. This proximal radio-ulnar joint, which is more open here, in this open joint anterior view, you can see when the child is pulled on the forearm, especially when you are pulling a child towards you with the force, it can damage and it can pull the head out of the, and it can damage the annular ligament and can pull the head out of the head of the radius can be pulled out, and this results in dislocation of the proximal radioulnar joint. Dislocation of the proximal radioulnar joint. Yes, this is what I'm saying. Good. So this was it. For tomorrow or for next revision, we'll discuss the bones and the muscles of the forearm. With that, I will end today's lecture. Keep revising, and hopefully we'll meet next time. Good night. Bye-bye.